Hey guys, welcome back to Medical Coding with Blue. Today's episode is all about the Hcpcs book, the Hcpcs book. If you are brand new to my channel, welcome. I am Blue. I'm a medical coder. I get this question a lot. Blue, I don't hardly hear anything about the Hcpcs book. What is it all about? And when do I use it? Am I always going to use it? So today I'm going to talk about some of the frequently asked questions about what it is and what it does and why do we even have this book. I am not going to show you guys my book, which is the Optum 360, because you guys know I love Optum 360. This is not an ad for Optum 360, but Optum, if you're watching, call me. I love Optum 360 coding books. There are many different publishers when it comes to medical coding books, and each publisher is unique. And yes, while they all have the codes in them, certain publishers have more information in theirs and some are more comprehensive, right? In what they're telling you about or giving you tips and things like that. I trust Optum 360 coding books. There are other ones out there. I have seen a couple of other ones, not really impressed with the other publishers, but I know that there's a few really good ones out there, and Optum 360 coding books are one of the best. At least that is my opinion. So what does Hcpcs stand for? HCPCS. It stands for Health Care Common Procedure Coding System. I had to get that to make sure I said it right. But yes, that is what it stands for. This book is all about the medications that can get administered. It's about the durable medical equipment that gets issued to the patient, bandages, crutches, wheelchairs, that kind of thing. That is what this book is for. So if you are coding and you're in a clinic that is issuing maybe a cold pack or something, it's like for physical therapy, and they're issuing cold packs, that's when you may have to use the Hcpcs code as well to account for the stock, the clinic stock that's coming out of the clinic, right? Because you have to be able to account for everything that the clinic orders when they're issuing things like that, durable medical equipment or crutches and things like that. You need to know how many of these are being issued. And it's really good when the coding is relied upon to be able to help pull those numbers and find out those kinds of details. And that's why it's very important to make sure that you're doing this correctly. There's many different things about this book. I really like it because the Optum 360 version breaks things down. It's got a lot of cool little symbols in it. So that way it'll help you. But the thing that I recommend about Hcpcs and getting familiar with the book is actually opening the book and getting familiar with it. A lot of people say, well, there's not a whole lot out there about Hcpcs. No, because Hcpcs is very straightforward. I mean, and that's when you're going to be looking up medications that are being administered or things like that. Or again, the durable medical equipment. So there's many things that are in this book. But like I said, get familiar with your Hcpcs book. If you have access to the coding clinic, Coding Clinic is an amazing resource when it comes to learning about medical coding and really getting into that high caliber coder status, studying. It is very helpful because the answers are coming from the people who designed the codes themselves. So it is really good. They have the AHA coding clinics, and that is the American Hospital Association, if you didn't know. Coding clinics. So that is very helpful. They have one for CPT and Hcpcs. Oftentimes you'll see CPT and Hcpcs together when they're doing these kinds of things because that's just the way that they do them. But Hcpcs is not hard to learn. It is just like the diagnosis book, is just like the procedure book. You have the index and then you have the tabular section. So it is very easy. It's small. It's not ginormous like the CPT or the ICD-10-CM book. See, I know it's going to show backwards, guys. Don't make fun of me, okay? I am not advanced when it comes to doing these editing things. And yes, I will get there. I will get to that point. But right now, my priority is sharing all this information with you guys. That's where my priority is. Eventually, I will get into learning how to do the editing. Well, keep in mind, guys, I am filming 48 episodes this month alone for Vlogmas and for my regular shows. So the only time I'm not going to be filming this month is going to be for New Year's Eve, Christmas Eve, and well, Christmas Eve is going to have Vlogmas, but Christmas Day I'm not filming. So those are the only 3 days that I'm not going to be filming. So this month, so again, 48 episodes that I'm going to be putting out. So it's a lot. And so it's one thing at a time, and I tend to prioritize what I think is most important. So it's you guys, the filming, and all this other stuff. So that is why. But anyway, this is mine. Yes, I know it's backwards, but we're going to go past that. It's very thin. It's not really thick at all. But it is, it doesn't have a lot of, it's just, well, it does have illustrations in it. I was going to say it didn't, but it does. But it does have like just different things for prosthesis. It has back braces in here, albuterol, that kind of thing. It's got all kinds of injections. Like it lists all the codes for the injections. If you're in a clinic and let's just say, for example, they're injecting Kenalog. Kenalog is a steroid. That code J3301 can be found in the Hcpcs book because that identifies the Kenalog. So that is just an example. When you are coding, you're not going to code things like the numbing agents like the lidocaine and the ibuprofen. You're not going to code those because that is included. It's an inherent part of procedures because it is understood that you're going to have a numbing agent, right? But things like a steroid is going to be picked up because that is something that is important to know. It is important to know that the patient was injected with a steroid because if something happens to their blood sugar, it's understood why. So that is the ins and outs of this book. It's very simple, very easy, which is, I think, a lot of times why we don't really talk about it too much. It's just something that is just sort of there. When it comes to knowing like the different things, sometimes you do have to rely on Google to look up, because they'll use the brand name and you may have to find the generic name in order to find the code. So that sometimes does happen. So it's going to be called something else. I think trisimilone, it is called something else. Kenalog is called something else. But that's when knowing how to do your research is going to help you. So sometimes if you're not able to find stuff in the Hcpcs book, just look and see if there's an alternative name for whatever it is that you're looking for. All right. And a lot of times too, and I will say this, if you are working in a clinic and they give out like inserts, right? And like in a podiatry clinic, ooh, podiatry. I code for podiatry, that's why I did that. If they are issuing a set of inserts, right? The Hcpcs code will actually be on the box. A lot of times it will be on the box. Anything that they're issuing, braces, any kind of, even for wrist braces, that will also be on the box. It'll be the little Hcpcs code. You'll see it because it'll have a letter and then it'll have the 4 digits. So it's very easy to spot, and it'll say Hcpcs. And then it'll give the exact code for that particular brand of whatever DME it is. And sometimes you can actually, if it's not on the box, you can actually put in the name of the brand name of whatever they're issuing into the internet and ask what is the Hcpcs code for. And usually the code will pop up if you can't find it on your own. So when you find a code, and if it tells you what the Hcpcs code is, look it up in the book to make sure that it is actually correct, because sometimes these things on the internet, they don't always get updated, and sometimes you're looking at old information. So that is something to be aware of, but it is an alternative to be able to find things, because sometimes you can't really think of like, well, how would this be? Is this an orthotic, or is this a brace, or is this, what is it? Is this a sleeve? You know, that kind of thing. So that is something that, to help you, just so you know, if you are looking to do that, that is a really good resource to look into to help you. But yes, that was that one on that. And what else can I say about Hcpcs? I mean, I like Hcpcs. I mean, Hcpcs is, I think, the best way to describe Hcpcs is it's like a supplement to the CPT codes. Sometimes it's not. Sometimes the Hcpcs is just it by itself. It doesn't even need a Hcpcs. I mean, it doesn't even need a CPT code, like a procedure code. But sometimes there's a evaluation and management code, obviously, with it. That is totally fine. But yeah, sometimes it doesn't have to have a procedure code also to go with it. So just something to know. But yeah, that's pretty much it. It is very, very much straightforward. There's not a whole lot to it. Like I said, get familiar with the Hcpcs book and really sort of look at it, because the more that you look at it, and even if you're just looking at these words, even if you can't pronounce them, because sometimes I can't pronounce these words either, and I just look at them so I know that I saw that word, and then I'll know where to look for in the book. So I've done that before several times, but everything that's in this book doesn't necessarily mean that it is worthy to be picked up. All right, so that is another thing too that you need to be aware of. Make sure that everything is supported in the documentation in order to pick up these Hcpcs codes. You can't just be picking them up willy-nilly because it's understood that they're going to get crutches. Well, did they say that I issued a set of crutches for this patient? If they didn't, you can't assume that they got those crutches. Maybe they have crutches already, or maybe they have a one of those knee scooters, which I think the little knee scooters is kind of cool. And you can just sort of stroll around on those. I have seen people with those, and I always want to get that and just sort of like zoom down the hallway, but I can't do that. I mean, it's a, safety issue just to go speeding down the hallway, but it's something I've always wanted to do. I don't know. Maybe I'll have to borrow somebody's sometime to be able to do that. But that is just something that I was sharing. Anyway, yeah. So pretty much, yes, that is what it is. Hcpcs is very straightforward. It is really easy to learn. And really, it's going to be like the last thing you're going to learn too when you're learning. Because typically, you will learn ICD-10 CM first. Then you'll learn CPT. If you're learning PCS, you'll learn ICD-10 PCS after that, or maybe before the CPT part. And then you'll learn Hcpcs. And Hcpcs is usually just very brief. So again, it's just very easy and straightforward. And there's not really a whole lot to it. It's just one of those things that it's there, it needs to be there, but that's just why. So I'm going to wrap this one up very short and sweet tonight. Thank you guys for joining me. I hope that you'll join me tomorrow. Tomorrow's episode will be Letters to Blue. It got moved to tomorrow because I just didn't get here in time. So if you are a medical coder, a medical coding student, somebody curious about the fascinating world of medical coding, a provider, or a nurse, I invite you to like and subscribe and follow me on my journey in medical coding. I will see y'all next time. Bye.